एवरीवन, माय नेम इज नितिन दिवाकर और आप देख रहे हैं फार्मा टॉक्स। जीपैट 2022 की सीरीज में आज हम लेके आए हैं फार्माकोलॉजिकल क्लासिफिकेशन ऑफ ड्रग्स। आज हम बात करेंगे ड्रग्स से रिलेटेड और वो ड्रग बिलोंग्स टू विच क्लास। डायरेक्टली क्वेश्चन जीपैट में आता है कि यू हैव टू आइडेंटिफाई विच क्लास ऑफ दिस ड्रग बिलोंग्स टू। उस सीरीज में हम बात करेंगे। लेट्स मूव अहेड। Autonomic nervous system means which controlled by itself, or autonomic nervous system is a part of peripheral nervous system or component of peripheral nervous system that regulates involuntary processes including heart rate, blood pressure, respiration, and digestion and other biological activities which are controlled by itself or automatic are called autonomic nervous system. So in this that cholinergic drugs comes under the autonomic nervous system. That cholinomimetics means which mimic the action of acetylcholine, or drugs parasympathomimetics which mimic the action of parasympathetic nervous system. In cholinergics agonist, that choline esters comes and alkaloids also comes. Then choline esters in this class, acetylcholine is example, methacholine is example, and carbachol and bithanicol. These are the four examples comes under the choline esters. Then alkaloids. These are the three alkaloidal drugs are there. First one is muscarinic, pilocarpine, ercolin. These are the comes under the alkaloid. Alkaloids you have studied in pharmacognosy. Some are the natural sources drugs. Then second class in cholinergic drugs is anticholine esters. Anticholine esters means which drugs, these drugs act on the choline esterases जो enzymes से उस पे act करता है. In this class they have classified in two types, or first one is reversible, second one is irreversible. Though in reversible, first is carbamates. In the carbamates, first drug is physostigmine, neostigmine, pyridostigmine, edrophonium, rivastigmine, donepezil. These drugs comes under the carbamates. Reversible category of drugs comes under the anticholine esterases. Then in reversible, that acridine derivatives also there. In acridine derivative only one drug is there, that is tacrine. देन इरिवर्सिबल में कार्बामेट्स आते हैं. कार्बामेट्स में कार्वेरिल, सेविन इज ब्रांड नेम, एंड देन प्रोपक्सर. देन ऑर्गेनोफॉस्फेट्स. then in organophosphates drugs comes like diphlose, ecothiopate, melathion, diazinon, and tibone, serine, and so many. These drugs are comes under the organophosphates. Then second type is anticholinergics. That comes muscarinic antagonist, atropinic drugs, and parasympatholytics. Light cholinergic drugs, natural alkaloids are coming. Natural alkaloids will come. In that natural alkaloid, atropine, hyoscine, this also known as scopolamine comes. Then semi-synthetic derivatives. Natural alkaloid means some that these drugs belongs to these drugs comes or obtained from natural resources. That's why it known as natural alkaloid. Then semi-synthetic derivatives. In that, semi-synthetic means some part of that drug it belongs to synthetic and some is natural resources like group or moiety, functional moiety. So atropine, methonitrate, homotropine, hyoscine butyl bromide, ipratropium bromide, and tiotropium bromide comes under the semi-synthetic derivatives. Then synthetic compounds. In synthetic compounds, they are classified in four types. First one is anti-secretory, antispasmodic drugs, then mydriatics, basico-selective, and anti-Parkinsonian drugs. In anti-secretory, that they again classified in two types, that quaternary compounds and tertiary amine. Quaternary compound. In quaternary compounds, propanthyline, oxyphenonium, clidinium, Pipenzolate, methyl bromide, isopropamide, glycopyrrolates comes under the quaternary compound. Then in tertiary amines, dicyclomine, belathamate and pyrangiapine comes under the tertiary amine. These drugs comes under the anti-secretory spasmodics. Then comes, let's come to the mydriatics. Mydriatics. Then comes cyclopentolate, tropicamide, and then vesicoselective oxybutynin and flavoxate and tolterodine. Then anti-Parkinsonism. These drugs used against the Parkinsonism. That's why it is called as anti-Parkinsonian. Trihexyphenidyl. That brand name is benzaxole. Then procyclidine and bepridine. These drugs. Then ganglionic stimulants. Ganglionic stimulants means which stimulate ganglionic receptor is called as ganglionic stimulants. They have classified in two types. First one is selective nicotinic agonist. In that selective nicotine comes lobeline, dimethylphenyl piperazinium, then tetramethyl ammonium, then varenicline. Non-selective muscarinic agonist, acetylcholine, carbachol, pilocorpine, anticholinesterases comes under the non-selective muscarinic agonist. Then ganglionic blocking agents, competitive blockers are there. Competitive blockers classified in three types. First one is quaternary ammonium compound. In that quaternary ammonium compound, two drugs comes. Those are hexamethynium and pentolinium. Then amines, mecamylamine, pempidine. Then monosulfonium compounds comes. In that monosulfonium compound, trimethophan compound sulfonate comes under the monosulfonium compounds. Then in ganglionic blocking agents, one more category is there. Persistent depolarizing blocker, nicotine anticholinesterases comes. In that nicotine large doses are used here, and in selective nicotinic agonist means निकोटीन जो है यूज हो रहा है स्मॉल अमाउंट में, यहाँ पे लार्ज अमाउंट में यूज हो रहा है. यहाँ पे एंटीकोलिनेस्टेरेजेस है, लार्ज अमाउंट में यूज हो रहा है या लार्ज जो डोज यूज हो रही है, बट यहाँ पे एंटीकोलिनेस्टेरेजेस की लेस अमाउंट में यूज हो रहा है. दैट्स व्हाई these have different actions in our body. Then adrenergic drugs or sympathomimetics. Adrenergic drugs or sympathomimetic drugs are those which mimic the action of sympathetic nervous system or adrenergic nervous system, is known as sympathomimetics. In this classification are there, pressure agents are there, bronchodilators, CNS stimulants, uterine relaxant, cardiac stimulants, nasal decongestant, then anorectics. Pressure agents, noradrenaline, it is also known as norepinephrine neurotransmitter, ephedrine, dopamine, phenylephrine, methoxamine, mephenteramine. Then bronchodilators means which dilates bronchioles, bronchi. In that isoprenaline, salbutamol, these bronchodilators are used in asthma condition. Albuterol is the brand name. Terbutaline, salmeterol, formoterol, and then bambuterol. Then CNS stimulants are those drugs which stimulate the CNS. That amphetamine, dexamphetamine, methamphetamine, and methylphenidate comes in CNS stimulant category drug. Then uterine relaxants. In that uterine relaxant, ritodrine, isoxsuprine, salbutamol, then terbutaline. These drugs, salbutamol and terbutaline, is also bronchodilators. Salbutamol and terbutaline, you can see this. Then cardiac stimulants, which stimulate our cardiac action. That adrenaline, it is a fight or flight hormone. Isoprenaline, dobutamine. Then nasal decongestant, xylometazoline, oxymetazoline, nefazoline, phenylephrine, phenylephrine, phenylpropanolamine. These drugs comes under the nasal decongestant. Then aneurotics, amphetamine, fenfluramine, dexfenfluramine, and sibutramine. These drugs comes under the adrenergic nervous system. So for today, it is I think it is sufficient for you. Please subscribe our channel, and if you have any query, any comment, any query, let's comment in below. Thank you for watching. Thank you for your time.